it's really cool to see like all these newer technologies that we can help people with their pain. What is your like favorite procedure that you do?
So I have to say, I really like basivertebral nerve ablation. Is that something you're familiar with?
Actually, like, yeah, my pain colleague in my practice does it.
Yeah.
And we're actually just talking about this the other day. So tell people what that means.
Yeah. So the basivertebral nerve is a nerve that basically provides innervation to a certain part. Oh my gosh, where's my spine model? To a certain part of your vertebral
Yeah, I need
body.
it.
And so basically, this is kind of the front part. It's called the end plates. And so a lot of patients who have that type of pain, it's called anterior column pain. So a lot of times they'll have pain with bending over and a couple of different things that it's really important to get on history, as well as physical exam to rule out other causes of back pain. And essentially what we do during that procedure is we go into the vertebral body, kind of like a kyphoplasty, and we access the vertebral body, and then we deploy some probes that essentially allow us to ablate the basivertebral nerve. And so the nice thing about that procedure, which is a little different from other ablations that we do, because we do also do ablations of, the medial branch nerves, but this is kind of a one and done. And so we're able to do that at a particular level for a patient, and then, they don't have to kind of do it again. Thank you. So this is, I love my spine model. I'm always like in clinic, I'll like pull up pictures and, use the spine model. So this is the vertebral body. And so the basivertebral nerve kind of courses this way. And so we go in here, it's a pedicular approach. Some people do like an extra pedicular approach as well. And then we can go ahead and ablate the basivertebral nerve. And so the end plate is kind of this part of the spine. And so we'll look for certain changes on MRI. So motive changes are something that we look for on MRI. And there are some other things as well. So it's great. It's a really great procedure that can help a lot of people.
And that's the Intracept procedure, correct?
Yeah, Intracept. And then there is another company that has come out with kind of their own tools for it as well. So now it can kind of be referred to a little bit more generally as a basivertebral nerve ablation. But yeah, Intracept procedure.
And like, for me, like, I think it's really cool because, it's hard to know patients that are like, we do a lot of disc replacement for similar problems or motive changes and impulse. And I think that procedure as well, but it works so well. It's one of my favorite procedures we do. But if an Intracept procedure can help patients, before they get to that point of needing hardware put in their spine, I think it's worth a shot.